Welcome to my podcast. Today I'm going to talk about collective case about any skin problem. So basically, after you introduce yourself and double check the patient name and date of birth, you'll ask the patient, "How can I help you today?" So the patient might say that I'm having something in my skin that I'm really worried about, or the patient says that I'm seeing something appearing in my skin and it wasn't there before. So you will ask the patient, "Can you tell me more about it?" So the patient will say their own stuff, and then you will try to narrow down the question in order to understand and get a big picture about the issue. So basically, you will ask the patient firstly, whereabout in your body? So can you point your finger whereabout? Which side of the body? Is it a covered or sun exposed area? And then you will ask how long ago all started. How did you notice that? Did you notice it yourself or someone had noticed it? Is it itchy at all? Is there any scratching? Does it become red, for instance? Does it bleed? Is it soft or hard? Is there any scales, for instance? Does it catch on your clothing when you dress up? Any change in the color or the border? So all of that questions you need to ask, and then you will ask, have you done anything so far about it? What's concerning you? Do you know what it could be? Do you have any family history with the same thing? Do you stay long time in the sun? Do you think it's related to the sun? And then you will try to get the whole picture before examining the patient. If it's exposed, you will have a quick glance, but if it's inside his body or her body, you will just ask some questions in order just to have a picture in your mind what it could be. And then you will ask the other normal questions, which is basically any past medical condition that you could be diagnosed with or suffer with. If there is any medication that you take in the long run, sometimes some patients they are taking immunosuppression for quite a long time, so there might be some skin cancer that can be predicted to be associated. Also, if the patient living or working dominantly under the sun, so that could be another thing that we need to think of. And also you will ask the patient if there is any known allergy at all, and if there is any family history with the same thing. It could be genetic or something runs in the family, like certain skin diseases. And then if the patient had tried anything at all, sometimes some patient they will buy OTC, or they're going to make some research online to understand what's going on and try to treat it basically by themselves. So you will ask if there is any herbal or complementary medicine could be used or have been tried. All of that you just to explore what might be going on, because sometimes the picture can be changed if the patient did something by their own or by advice from some friends or their peers. And then you will ask about the lifestyle basically, and the smoking and the drinking habit as well. And then you will examine. You'll see whereabout in the body. So if it's, for instance, I remember in my lab too, after I took the whole questions, they just had me a photo, and it was basically seborrheic keratosis. So in that situation, you reassure the patient and explain that it's something happened once we hit aging and as we grow up, and there is nothing to worry about unless it's eruptive, and sometimes can be annoying or can be distressing for certain patient. So, or if it catches like skin tag. So in that situation, you will offer the treatment. Otherwise, they need to go for cosmetic removal. Another skin cancer worth considering is SCC and BCC. So BCC is more common in the face. It's not worrying, but it can be because it's slowly growing and can be destructive. So according to the type and the location, you'll decide the treatment or the referral. However, for SCC, it's need a quick 2-week wait referral to the dermatologist to be dealt with. Another skin cancer, which is worth consideration and should be treated without any delay, is malignant melanoma. As we all know, sometimes it runs in family, so you need to examine the patient thoroughly, every area on the body, especially if you suspected or saw patient with multiple nevi in the back or in the calf area of ladies. So I need to examine thoroughly, and even in the body fold, palm soles, nails, and according to the finding, you will also arrange for a 2-week wait referral to be seen by the dermatologist, who will treat them accordingly. Of course, when you saw and examine the patient, you will discuss with them what could be the diagnosis or the provisional diagnosis, and then agree with the patient the management plan to be taken forward, and ensure that the patient is well informed and happy for the management to go ahead and take place. So that's basically for the skin. Anything has to do in the skin of in the skin surface. There is another condition which is also seen in the dermatology. It's lipoma. So it's basically a mass of fat. Sometimes the patient will come to say to you that, "Oh, doctor, I'm having a lump, maybe in the shoulder, maybe in the neck, maybe in the forehead, maybe in the scalp, maybe in the body, anywhere." They are very distinctive with their soft consistency and lumpy in touch. So basically, you will explain to the patient that in most instances it's not worrying, but just need to be removal. There's different ways to remove it. So you just discuss with the patient different ways, or just a simple way how to be removed. Usually it's removed in a minor surgery. However, such a situation, they refer them to the surgical department, or it could be also in dermatology. Another case is related to dermatology is ganglion, but it can be also with orthopedic, but in most instances it's also in dermatology. So the patient might come with a solid, rounded, we could say like a nodule on the dorsal aspect of the hand. That's the most common place. And the patient might say that I feel like heaviness, or it's just popping with the flexion of the hand. So you'll explain to the patient that sometimes the tendon, that area, for certain reason, they get like a cysting, which is usually full with gelatinous material. And in most instances, it disappears by itself, but in certain situations it stays. The patient, they get worried about it, so you just explain to the patient that there is nothing worrying about it. It's benign, completely benign. And in such a situation, in the old time, they used to incise and remove it. However, nowadays they do like aspiration, and then you just inject intralesional Kinacort, and we just apply pressure, grip band, it does well. So that's basically in brief, mostly about the commonest skin condition that can be encountered in Lab 2 and how to approach them and deal with them. Thank you.